nice enough to let me do this. So hopefully you can see everything in the screen, but I'll try to adjust it so you can see when he's standing and everything. So we'll start with orientation questions. So Kyle, I'm going to ask you a couple of questions, and we're just going to go through from head to toe and assess your body and your health and all of that. So Kyle, tell me what year it is.
2021.
Okay, tell me your full name.
Kyle Ryan Basaker.
Tell me who the President of the United States is.
Joseph Biden.
And can you tell me the month?
It is August.
And where are you right now?
At our house in Roy, Utah.
Awesome. So all of his orientation questions were perfect. So we're going to move on to the cranial nerves and his senses. So I'm going to check some of your cranial nerves right now. I want you to close your eyes, and I'm going to bring 2 scents in front of your nose, and you tell me what scents you're smelling, okay? So close your eyes. What scent is this?
Coffee.
Cover the other nostril. What scent is this?
Vanilla.
Awesome. So those are okay. You can open your eyes. We're going to assess some of your other cranial nerves, and this has to do with your ocular muscles. So I'll use my pen light. If you can just go ahead and look straight ahead, I'm going to test your pupils for constriction. Good. So the pupils constrict the way that they're supposed to. So I want you to look straight ahead and don't move your head. But I want you to follow my pen with your eyes. So we'll move up. Okay, good. And I want you to look over here. Look over here. Okay, awesome. And can you see, looking straight ahead, can you see both of my hands out here?
Yes.
Okay, awesome. Now I want you to smile. Awesome. Lift your eyebrows. Frown. Puff out your cheeks. Stick your tongue out. Good work. Okay, so all of his facial muscles are moving well. So now what I want to do before moving on to checking your skin and all of your body systems, we'll do the neurological assessment for musculoskeletal balance, so that you only have to stand up once. So go ahead and stand up. Hopefully I'm going to show you his gait, so hopefully you can see all of that. You can kind of. Okay. So I want to have you scoot back just a little bit. Okay. And I'm going to have you stand with your feet together. I'm going to have you close your eyes. And this is the Romberg Test, so I would do this for 20 seconds, but for the sake of the video, I'm going to just have him do it briefly. But close your eyes. And I would just be checking to see if there's any swaying or balance issues while his eyes are closed. So it looks like he's doing that great. You can open your eyes. And I just want you to walk heel to toe like that to the front of the room and back. Okay, perfect. You're doing that great, so you can go ahead and have a seat. Oh, wait, sorry. Would you be able to stand up real quick one more time? And I want you to stand on one leg and move your heel all the way up your shin. Good, now do the other leg. Okay, perfect. Go ahead and have a seat. Okay. Now I'm going to test some of your rapid movements. So what I want you to do is touch your thumb, your pointer finger, all your fingers to your thumb, like this, and then gradually speed up. Okay, good work. Next, I'll have you put your hands face down on your legs, and I want you to lift your hands and twist them, and gradually speed that up. So that's working well. Now I'm just going to take a look inside your nose, your mouth, your ears, and look at your head and see if there's anything, lesions or sores that I could have missed by just looking. So I'll look in your ears. I'll find my pen light. So I'm going to look in his ears. If I was at a doctor's office or at a hospital, I could use the scope to look in his ears and nose and mouth, but I'll just use my pen light for this time. So I'll look in his ears, see if I'm seeing any malformations or issues with his ears. Everything looks great there. The tragus looks normal. Is there any pain when I pull on your ear? No pain? Okay. So I would look at the other ear as well. Everything looks great there. Is there any pain with this one?
No.
Okay, and then if I was at a doctor's office, I could use a tuning fork to test his hearing. So we'll just pretend that was done. And also, the Snellen test was done before coming into the office, so I know that his vision is 20/40. So now I'm going to just look in your nose. You can just tilt your head back a little bit. I'll look up his nose to see the mucous membranes look great. I can't see with the pen light, but I would be looking at the inner part of his nose to make sure that there's nothing obstructing his smelling. So I would close one nostril. Can you breathe through that one? Can you breathe through that one? Good. So I'm going to have you open your mouth, and I'm going to look in your mouth. Say, ah. Okay. And his teeth look good. He doesn't have any sores or lesions in his mouth. Can you move your tongue around? Tongue moves great. And I would use a tongue depressor to check his gag reflex as well. So that part's done. I'm going to take a look at your head. I would palpate to see if there's anything I may be missing by seeing that I could feel, but everything feels normal. So you can put your head back. Now I'm going to palpate for your thyroid, see if I feel any nodules. And I'm going to feel your lymph nodes to make sure that they're soft and movable. Are these tender at all when I press on them? No. Okay, I want you to open your mouth, close your mouth, bite down. Is any of that painful?
No.
I'm going to check to feel your pulse, one pulse at a time. I want you to lift your shoulders and turn your head against my hand, the other way. Okay, so now what I would do is I'm going to listen to his heart and lungs, and I'll have him turn this way so that I can show you the 7 spots that I would listen for his lungs and also the important parts for his heart. So I would have him take some deep breaths. Those are the 7 parts of the lung that I listen to for the lung. And then 8 and 9 are on the sides. So I would check, can you take a deep breath? To make sure that the chest rises and falls, or the anterior thorax rises and falls at the same time. And now I'm going to ask you to say some words or letters while I listen to you. Say 99.
99.
Whisper 1, 2, 3. And I want you to say E like in B.
E.
Okay. So that all sounds great. And now I'm going to listen to his heart, and I'm going to point out the locations of the heart that I need to listen to. So this is the aortic, pulmonic, Erb's point, tricuspid, and mitral. Also going to listen to the lungs. So everything sounds great there. I'm just going to check the radial pulses while I'm here, and then I'll have him lie down so that I can assess his abdomen. So his radial pulses are right here on his wrist. Those appear to be doing well. Can you squeeze my fingers? Good job. Equal. I'm checking cap refill, making sure that it's less than 3 seconds. Okay, I'm going to have you uncross your feet. so I'm going to just assess his pedal pulses. Those are present. Can you pull up with your toes? Push down like a gas pedal. Good work. I'm going to check calf refill on both of his feet. Good. Those look good. And I'll also just check the popliteal pulses as well, which are behind his knees. Okay, and those are also good. So I'm going to have you lie down with your head over here. So I'm going to listen to the bowel sounds in all 4 quadrants, and then I would inspect his skin, but I'm not going to have him remove his clothing for the video, so I would inspect his skin before doing any auscultating, percussing, or palpitation. But I will inspect the abdomen, auscultate, and then percuss and palpate. Okay, so bowel sounds are present, so I'm going to just do some light palpation. Actually, I'm going to percuss first. So I'm going to percuss for his liver, which is on this side. So I can hear his liver right there. And then I would stand on the other side to percuss for his spleen, but because this is where we're doing, I can't get on that side. It's a couch, so. So I'm percussing his spleen. So I'll do light palpation first. Is there any pain and tenderness when I push on your abdomen?
No.
And then I would do deep palpation, feeling for his liver. And his spleen. And feeling for any nodules or masses that could be felt. And I'd also look for the aorta. And I should listen for his aorta to see if there's an aortic bruit. So I don't hear any of that. So you can go ahead and sit straight again. And now I'm going to show you, I don't have a reflex hammer, but I'm going to show you where I would normally test for his reflexes. So it's the tricep, the bicep, the tricep, the patellar, and the Achilles that we would be testing. So if I were to test his bicep, I'd kind of have him just relax his arm like that, just rest it. And then right here is where I would hit the reflex hammer to make his arm move as a reflex. For his tricep, I would hold his arm, supporting all of its weight, and I would hit here to see his reflex. For the patellar, I would have him dangle his legs off of the chair or if he was on the examination table, and I would hit right here to have his knee patellar reflex occur. And then for his Achilles, I would still have his feet dangling. I would have him cross his legs, his calves, and I would hit the Achilles right here to have his reflex happen there. And one thing I forgot to do is to listen for any bruits. Listen for any bruits or sounds. Sorry, that's my dog. So I don't hear anything, and he's a perfectly healthy individual. So thanks for letting me use you and do a head to toe on you. And that's the end of my head to toe.